Thank you, Donnie. Thanks for sharing your and your family's story with us. It is truly inspiring. The human impact of healthcare is the driving force behind Resolution Number 6, making healthcare a reality for everyone. The resolution forcefully lays out the case that the healthcare status quo is not acceptable to working people, and that the labor movement must fight for major changes. The American labor movement has fought for more than a century to make quality health care a basic right in the United States. We are committed to moving expeditiously toward a Medicare for all single-payer system. I'm tempted to reach into my pocket, because I'm still a Canadian citizen, and pull out my health care card that when I cross the border don't cost me a dime for any service. A single-payer health care system that provides universal coverage while retaining an important role for workers in the health care plans. The resolution encourages and urges significant and immediate steps towards single-payer, in particular lowering the Medicare eligibility age to 55 and creating a public option as an alternative coverage provided to the for-profit insurance companies. This resolution also commits the AFL-CIO to work with the co-sponsors of single-payer plans to ensure that they meet the needs and concerns of working people and their unions. That is because this resolution reflects our focus on strengthening and preserving the health care plans that workers now have, in particular multi-employer plans and other patient-centered worker plans that must be strengthened by eliminating the misnamed Cadillac tax. And we must break the corporate monopoly on health benefits so that more workers can benefit from what collective bargaining has achieved. The resolution also commits addressing other fundamental flaws in the healthcare system, like excessive prescription drug prices, inequities based on race, gender, age, ability, or sexual orientation, and absolutely the need to end the preventative and opioid crisis that can be prevented if we work at it. And hundreds of people are dying every day, and that's a damn shame. Finally, the resolution calls on the labor movement to ensure healthcare workers are safe on the job and paid fairly, and it commits to building on our success, beating back attacks on Medicare and Medicaid and the ACA. In short, the resolution number 6 is about building on what we have achieved already and winning what we need. The resolution committee recommends adoption of resolution number 6, and I so move. Brother Chair.
Chair recognizes the delegate at mic 1.
Good morning. My name is MarthKuhl, and I am Secretary-Treasurer of National Nurses United. The 150,000 members of NNU are proud to support this resolution, stating that healthcare is a human right and that we must guarantee it through an improved Medicare for all system. Every day at the bedside, nurses see the impacts of private insurance-based healthcare industry that denies care and diverts resources away from patients. You've heard the stories from our co-workers here. I am a nurse who takes care of children with cancer, and I witness these stories daily on the job of a failed private health insurance system. We must guarantee health care as a human right. In healthcare, we must return to the values of caring, compassion, and community, and turn away from an industry model that treats patients based on race, class, gender, immigration status, and the ability to pay. Only through Medicare for all can we establish a single safe therapeutic standard of care. Patients' need, not profit, must be the basis of our healthcare system. We spend more and get less than any other civilized country in the world. We live shorter lives. We have mothers and infants who die at higher rates. Big corporations make obscene amounts of money on drugs. $82 billion in profit since 2011. Insurance companies charge whatever they want and pay way too much to executives like Stephen Hemsley at United Health, $66 million in 2015. And that it is our hard-earned healthcare dollars that we struggle to get in negotiations. And now our employers want to shift more and more costs to all of us. And our sisters and brothers here who have health and welfare trusts know acutely how hard they have struggled to maintain health benefits. So we are to truly keep the ACA benefits and to move this to health care for all, we are proud to stand with labor today to guarantee health care for everyone through a Medicare for all system that addresses just transition for all affected workers. NNU is organizing across the country, in California with SB 562 and nationally with S1804, introduced by Senator Sanders and co-sponsored by 16 other senators. Both bills are consistent with this resolution. So join us, get active, and vote yes. Make health care a human right. Thank you.
Thank you, sister.